An original
from Story Studio Network.
I'm Dave Trafford, and this is the 2030 Project. The 2030 Project is a Story Studio Network podcast sponsored by Daily Bread Food Bank, a Toronto-based charity whose mission is to collaborate with all to eliminate food insecurity and advocate for solutions to end poverty. After 3 years of consultations, legislative crafting, committee reviews, and political pushing and pulling in the House of Commons and in the Senate in Ottawa, the Canada Disability Benefit Act finally received royal assent on June the 21st, 2023. It's intended to raise those living with disabilities in Canada out of poverty. Can it? Will it? In this episode, we're going to explore who should be eligible to receive the Canada Disability Benefit. How do we actually define disability? To help us navigate these and other questions around eligibility, we're joined by advocates and activists from across the country. They've got lived experience. They've been on the front lines of the push to make the Canada Disability Benefit Act a reality. That has happened. So let's meet our guests.
Hi, I'm Trevor. I'm a secretary co-chair with ODSP Action Coalition. I've been on ODSP since about 2016.
My name's Michelle Hewitt. I live in Kelowna, BC. I'm the chair of the board of Disability Without Poverty. I'm also on the board of Disability Alliance BC.
Really what we'd like to do in this case is talk about the whole question of accessibility as far as a national program is concerned. And from that perspective, be able to kind of get at what are the, not necessarily the challenges, but what are perhaps the opportunities. Let's put it that way and be positive about that based on your own experiences with the situations specifically in Ontario and British Columbia. Michelle, if there were one thing that you would point to and say to get the accessibility question or issue right from the national perspective, what's the first vital step that we must take and must take correctly?
I think the first step is to sort out eligibility and make it as simple as possible. No more hoops of differing sizes and shapes that you have to renew at different times. Everybody who is already eligible for a provincial, territorial, federal, private insurance program should just be, fast-tracked into being eligible for this new benefit. And then that would take, that whole question of, the accessibility, the definition of disability, for the vast majority of people that are going to access this benefit, that would take it all right off the table. One of the issues, I think, is that the federal government needs a list, as we kind of keep hearing them say, to be able to give this to. And the list that they currently have isn't necessarily the list that works for us as disabled people, because that list is the disability tax credit, which is one of the least accessible things for people who live in poverty, because first of all, in its title, it's a tax credit, right? And so if you're living in deep poverty, your first priority is not to try and find not only the mechanisms, but the money to apply for a tax credit. So I could go on, but I'll pause for a bit.
Well, and I do want to come back to that because those are important points in the conversation. Trevor, from your perspective, what would be that first step? Is it for you that level of eligibility or that definition around it?
Yeah, I have to agree with Michelle there. The definition of disability is a big one, and eligibility by proxy is what we're calling it, and that is people who already qualify for provincial disability support programs should automatically be enrolled in it. And as Michelle indicated, the federal government, the lists, so-called lists that they have will be based on people that have the disability tax credit. And we know that the disability tax credit is notoriously difficult to get. And on top of that, the federal government also has CPP disability recipients. And across Canada, there's close to 320,000 people that are on CPP disability. I'm on CPP disability as well as ODSP. As a matter of fact, like 2/3 of my income comes from CPP disability. So in terms of the federal definition, that's what the two programs that the federal government currently has is CPP disability and the DTC, but proxy eligibility is going to be paramount so that people are not having to re-explain their disability time and time again.
I want to come back to some of the specifics, but I do want to point out that part of the conversation initially that we had in this series was the idea this was being driven by the nothing about us without us approach here. And you both pointed to other programs that, for better or worse, do or don't work. They have problems with them. Michelle, how much is it that is because they didn't sort of follow that initial path in some of those programs, nothing about us without us?
Yeah, I think you're absolutely right. It is because they weren't built with us or for us. They were built in models that are steeped in old senses of who poor people are and who worthy and unworthy poor people are, and so that in somehow if that you're reliant on these sorts of situations for your income, that somehow it's your fault. That, you know, if we talk about models of disability and we talk about, you know, the social model versus the medical model, there's very much a medical model of disability approach where we blame it on the individual and we say that that it's their situation and their way out of it. And so therefore we build a system that is built on the idea that people are out to milk the situation for all that they can. And, you know, I often say that like who wants, like in BC it's just over $1,400 a month, and I know in Ontario you're on $1,228. Really, if that's the situation you want to be putting yourself into because you think that's a great living, and you have opportunity to live better than that, I'm sure you're going to be choosing to do that. So I think this idea, there's this fundamental idea that we have to prove that we're disabled over and over again, and we have to prove it to different ways and to different groups of people. And I think that the more you live in poverty, that proof gets harder. In BC, we have a province of approximately 5 million people, and 1 million of them don't have a family doctor. And to get on any program, you have to prove your disability. You pretty much need a doctor that has a sense of your medical history to prove that happens. If you do, that they may be going to charge you. If you don't, and you have to go through, even if you can find a walk-in clinic that will fill the forms in for you, it can cost you like $150 for a medical form for a disability tax credit. And these are the people who are living on $1,200 a month when we know rents are, well, I know here in my hometown of Kelowna, you can't rent anything under than $1,500 a month. And we know that food inflation is way above regular inflation and has been at double digits most of this year and has just dipped below now to about 9%. The idea that you're going to stop and take time out of that to be able to find a doctor and then pay the amount of money that they're going to ask you is just ridiculous, and is just makes a system that is inaccessible to the people who need it the most.
Yeah, Trevor, when I listen to Michelle, the idea of the accessibility just to navigate the system, never mind having access to the benefit itself, sounds like more of a hurdle. I mean, just trying to make sure that you understand how best to advocate for yourself to ensure that you can even kind of get in line, never mind to the front of the line.
Mm-hmm. Yeah, it's almost incumbent upon us as people with disabilities to sort of do our homework, so to speak, and learn all the rules and the ins and outs so that we can clearly articulate and advocate for ourselves. And of course, not everybody has the capacity to be able to do that. So we're somebody who might be able to comprehend and articulate their situation clearly, and somebody that, is fortunate enough to have a family doctor. For those people, it might be a little bit easier. I don't want to say easier, but people that don't necessarily comprehend all of the rules and are not necessarily able to advocate for themselves, and people that don't have a family doctor, those people are so far away from getting on the system. We know that there's a lot of people in Ontario. There's a program called Ontario Works, which is, general welfare, so to speak. But we know that there's a lot of people on OW that have disabilities that just are not able to get onto ODSP for one reason or another. So it's really important that people that are having those difficulties have somebody there to help them navigate the process to be able to, just to access basic benefits for them to survive.
Well, I'll tell you, I like to think I'm a guy who's paying attention, Trevor, and I actually went to the website, ontario.ca and so on, and looked up the ODSP program and walked through what it would take to determine, in fact, whether or not I had access to the benefit. It's complicated. And, and again, like I said, I like to think I'm paying attention. So you've got to be really down in the weeds to be able to navigate that particular system.
Yeah. ODSP has over 800 rules. So it's really impossible for any one person to know everything about it. And, and sometimes even the caseworkers don't know all the rules. And you might get an interpretation of a rule. You might get it differently from one worker to the next. So there's a lack of uniformity on how those 800 rules are even applied. So it's a bit of a moving target sometimes.
Mm-hmm. Yeah. And Michelle, we in one of the episodes, we talked about some of the specific challenges, for example, that our Indigenous and First Nations communities face. And I know British Columbia is as diverse as Ontario is. And so I begin to wonder whether or not, or to what degree, the service is being offered, whether there's a language issue there, whether there's a cultural bias that's baked in that is unstated. All of those are really nuanced accessibility issues. And I wouldn't expect government to completely manage all of that, precisely, but that has to be taken into account, doesn't it?
Yeah, I hear everything that you're saying, and I hear everything that Trevor's saying, and I know that all of that is replicated here in BC, and I think that we do have biases hard baked into our systems, and the intersectionality of our marginal populations, right? As whether we're talking about people who are Indigenous people, racialized people, people with disabilities, whenever you start to bring any of more than one of those together, you find that, people are like, so who am I on this day? Who am I being discriminated by? Which of my identities am I discriminated by today? Or are they adding together to make a situation that I just can't kind of get through and can't get into? And, and I think as well, it's, if you've been beaten down by the system in multiple ways, right? Maybe you've had your disability is something that doesn't come by its diagnosis easily, right? I have multiple sclerosis, and for better or worse, mine happened over a period of 4 days and I never walked again. There are many people out there with MS that it's a gradual drip effect as you build up to that diagnosis. Well, if that, and that's the same kind of thing that will happen with people with mental illnesses or long COVID, fibromyalgia. So if you're in one of those situations where you feel that, that you're not believed because of the way you're presenting with your disability, and then you feel that you're not believed because of your identity, unfortunately, we have a lot of Indigenous people are believed to be alcoholic or before they're believed to be anything else. And, you think of something like MS, you typically, if you are walking, you maybe stagger a lot. Our local library here had a sign up in it that said that people who appear to be, we only serve people who appear to be sober. Well, I know people with MS that couldn't appear to be sober because they have MS, right? And so I think that, so basically if we go back to how we started at the start, and it's like, how could we, make all of this, make it all be as positive as possible? We could wave a magic wand over it all and say that the 800,000 to 1 million people in this country that are on some form of disability assistance payment, congratulations, you are already going to get the Canada Disability Benefit. And that would be the biggest gift that could happen to so many people, because otherwise, and because then beyond that, there's so many people that are already falling through the cracks of those programs. Let's just deal with those people, right? Let's not start rejudging things that have already happened.
So let me ask you then, Trevor, is that just good enough, or is that a good start?
Well, it's a start, at least. You have to start somewhere. And there will have to be another point of entrance to the Canada Disability Benefit for people who may not, for one reason or another, be on any other sort of program. So there is going to have to be, besides proxy eligibility, there will have to be another door to be able to access that. And it's going to be key to have peer navigators or professional navigators to help people walk through the application process to get on the program.
Mm. You've used the phrase proxy eligibility a couple of times. Give me a sense. What does that mean to you?
That means that people don't have to reapply. For instance, if people like in Ontario, the Ontario Disability Support Program, there's about 400,000 beneficiaries on the program. Those people should not have to reapply for the Canada Disability Benefit. It should be automatic, and that's what we mean by proxy eligibility. Mm-hmm. It means you're pretty eligible for one program. You should be eligible for the other one as well.
And we're going to dive deeply into the criteria around eligibility in another conversation, but it's really hard to have this accessibility without the eligibility question, I guess. Michelle, which one's the cart and which one's the horse for you?
Yeah, I think it's eligibility comes first, and then everything else can follow. I mean, I think one of the things that Trevor mentioned that is really important for that accessibility piece, though, is he talked about peer navigators. And again, nothing about us without us. I think those sorts of pieces for accessibility are really important because, as you know, so often we call and talk to caseworkers who are working through our applications, and they have no understanding of what it takes to be disabled, and they have no understanding of maybe that was the only hour in that day that you felt well enough to make the call. And they say, hey, you know, we can't talk to you till we've got this one piece of paper or something. And that's no good, because it may be another week before you're able to get all the pieces in place for you personally to be able to make that call again. So I think that those sorts of things are something that, go part and parcel with this. The Auditor General put out a report, I think last year, where basically she said that federally there are good programs and there are people in need, but the government has never done enough to join the dots between the two to make sure that the people in need are able to access the program. Building the program is not enough. It's not the Field of Dreams, build it and they will come. No, you've got to build it, and then you've got to get the buses, and you've got to invite them on board the buses, and you've got to take them to the program. And so I think that there's a lot of lessons to be learned as well in the way that provinces who have been delivering disability support payments for so much longer than the federal government. There's a lot of lessons to be learned. And, when Trevor talks about those 400 people in Ontario, can you imagine how much work it is if they all have to reapply? So that somebody has to go through 400,000 applications just from Ontario. It's an absolute waste of taxpayer money, right? Our money, as all of us, no matter who we are, we're all taxpayers one way or another. And it's just a ridiculous situation to think that we could even consider having to do that again.
Well, and it's not lost on me, as someone who is able-bodied, that we struggle with the idea of making a disability benefit accessible to those who live with disabilities, and it's really hard to make it accessible. It just sounds like such a tiger chasing its tail.
Absolutely. And that we haven't even got into the modes of accessibility, right? Whether, people who are nonverbal and all of the regular levels of accessibility that don't work for people, whether they have access to the internet or not, or, just all of those regular levels of accessibility that currently don't function for people. And so to put that on top of this is something that, potentially is going to hopefully lift you closer, or if not out of poverty, like closer to the poverty line or out of poverty. There's a lot of work to be done, and the lessons should already have been learnt, but we hear stories on a daily basis that those lessons aren't.
Well, and Trevor, I cite the number that comes from Feed Ontario, and these stats were collected prior to the pandemic, and they estimated, based on their research, that poverty in Ontario alone in 2019 cost the province somewhere near $33 billion annually. And I keep coming back to the question, how can we possibly afford poverty? So the point being to make this more accessible, to get this to a point where those living with disabilities who have a more stable income, stable housing, stable health care, all of those things. It's not just good for you, Trevor, as the individual, and we want it to be, but there is a distinct ROI here that we're either blind to or ignoring somehow for whatever reason, that if that were, if we could flip that switch and tell people this is going to, in the long run, be better for our economy and the health and well-being of everybody, not who lives in Ontario and right across the country.
Mm-hmm. Yeah, some people don't realize that it costs a lot more to keep people in poverty than it does to lift them out of poverty. You invest a little bit now upstream, and then you're going to see massive savings downstream in our healthcare system, in our judicial system, in our tribunal systems, and all of that winds up costing taxpayers more money in the long run.
Yeah, there's no question about it. And even, when we start to think about accessibility, and glad that Michelle brought it up, based on your experience here in Ontario, what's your sense of, ballpark even, the number of people who would struggle to access any of this guidance, information, whatever, application forms online because they just don't have adequate access to the internet?
I could only speculate. It's really hard to say. Yeah, I can't even put a number on that, honestly, Dave. It's a bit of a moving target.
Well, I'm guessing that when you're facing your rent numbers being what they are, your $1,200 max for an individual in Ontario on a monthly basis, that the internet bill might not be the first thing that gets paid.
Yeah, obviously, and there's a lot of people that can't afford to have a computer, to have connected devices, to even be able to access the information they need. And with the province's push, they have a digital first agenda that they want everything done online. And we've been advocating for a long time now that if you want this digital first agenda, you need to give people the resources to be able to get online. And people should be provided with some sort of a digital allowance. They have computers are available in libraries, but not everybody is able to make it to a library, to access a library. And even if they are able to get to the library, people don't want to be accessing personal information on public computers. If you're, a lot of this stuff, if you're applying and so forth, a lot of this stuff is very confidential personal information that you don't want to be using sitting in a library, with your social insurance number and everything on the screen in front of you.
Yeah. And that's an important point that, again, it's easy to say, well, it's all there and it's accessible. But, Michelle, if it comes down to you needing some clarity on it, all of a sudden you are into here's the chat bot that can answer your questions or the frequently asked questions. Did that solve your problem? Thank you for your help. That can't be the answer.
And I think the idea that everybody is just going to want to walk through the door of a library anyway, right? It depends on, the types of disability you have, the previous experience you've had, if any, in going into a library, the level of education that you have. There's all kinds of barriers before you even get to that door, and then have to display, as you said, your social insurance number on screen for anybody that walks past your shoulder. And as we get further north in every province and as we get to the territories, the internet connection gets worse, right? And so it may be that there are communities that have no community internet connection for people to go to. We can't even deliver drinking water to some of our First Nations communities, never mind the internet. So, it's a very... It's a very privileged position to think that this digital first situation is going to make accessibility easy for anybody who needs to access these kinds of applications, and then be able to go and it's like, how do you find out how your application is progressing? Well, you have to go back to that same place and wait for a free public computer to log in again to find out that, oh no, you missed one letter out of something, or they need another document, or whatever it is. It's just not user friendly and reminding us that this is a benefit for people who are living in poverty.
And I have steered us what might sound into a negative part of the conversation, but before we go, Trevor, I'm hearing a lot of folks looking at this guardedly as the Canadian Disabilities Benefit Act and saying, okay, this is a first good step, and there's something positive in there. What do you see that's positive in this?
It's positive that the legislation has at least passed, but the real work has yet to begin. The positives is the legislation has passed. There were some much needed amendments made in the Senate. There were a couple of tweaks in the House, and the process through the House of Commons and through the Senate, it allowed lawmakers to hear over and over again, particularly at committee, some of the issues that are urgent here. So it's good that the legislation's passed. It's good that we're having these conversations, but the real work in crafting the the regulations has yet to start. And that's where, the devil's in the details, like they say. And that's where the devil's going to be, is in these details. And it's reasons like this digital first, point of view. These are the reasons why we need to be at the table when these decisions are being made and when these regulations are being made, because they need the lived experience of people like myself, people like Michelle, people with disabilities, people in organizations like ours. We need to be at the table to remind them of the realities of what's happening on the ground, as it were, on the front lines.
Michelle, your thought in terms of where's the optimism here for you?
Yeah, so the optimism is that the preamble does say that the words nothing about us without us, and that the aim is to lift disabled people out of poverty. I'm kind of horrified that we still have to talk about in 2023 that disabled people shouldn't have to live in poverty, but at least this is here now, that the aim is to fix that. And I think it takes us all together to continually remind, people in New Brunswick get $786 a month, right? And that is just abysmal. If this does something to get those people to the poverty line, which in, Fredericton is close to $2,000, in my, the poverty line here where I am is $2,300. And I think for you guys in Toronto is just passing, it's 2,200 something for the, the poverty line for a single person on a monthly basis. So there's a ways to go, but we need people to understand that the poverty line is no lollipops and rainbows, that we need disabled people who are living in poverty through no fault of their own, just through life's lottery, to be lifted out of poverty. And if this is the way that we're going to get there, sure, it's not going to be perfect on day one, but you can guarantee that people like Trevor and I are going to be there every step of the way, pushing to get this to be everything that it could be.
Michelle, Trevor, thanks for your input, and we'll watch this closely. We'll probably want to follow up with you as this progresses. So thanks for being here.
Thank you very much.
Absolutely, my pleasure.
The 2030 Project is a Story Studio Network podcast that we are proud to produce. It is sponsored by Daily Bread Food Bank. If you'd like to help eliminate poverty, start by sharing this podcast with your federal MP, your member of provincial parliament, your local municipal representatives, anyone you think needs to hear this message about the Canada Disability Benefit. And to learn more, visit dailybread.ca. Mike Trutler is our technical producer and audio editor here at Story Studio Network, and the 2030 Project is produced by the team at Daily Bread Food Bank. I'm Dave Trafford. Thanks for listening.